Dr. Duncan Robertson has been with us every week. He's from Loughborough University, and every single Monday since March, he's talked us through the latest figures, the reasoning behind the science, and so on and so forth. Duncan, hi.
Hi, Ben. Hi.
Now, I get the slight impression that, as I say, we've spoken pretty much every Monday all of this time, that I kind of get the impression from your language over that time that you always thought that a second wave was, well, if not inevitable, then certainly highly likely.
Well, the thing about how you get a second wave is that the incidence of the virus takes off, and what the whole plan of getting out of these national lockdowns is we'd have a test, trace, and isolate system that would prevent the virus taking off again. And what we've basically found is that has failed, and therefore the virus has taken off again. And so with that not working, we are getting this second wave. And I think, the point is, if we're going to have this, these new restrictions coming in, what are we going to do in the meantime to fix the test, trace, and isolate system? Because otherwise, as soon as we release the interventions, we're going to be back in the same position of having to reimpose them. So that's what we should be doing in the time.
What caused the change then from regional lockdown measures to a national lockdown? I mean, there's lots of talk about the projected figures exceeding the reasonable worst case. What do you know about that?
Well, I mean, SAGE and the science, if you like, has been projecting what could happen if measures aren't taken, particularly things like test, trace, and isolate. And ever since mid-July, there's been this reasonable worst-case scenario number. So of around double the amount of the first wave. So really, the scientists have been warning about this for months, that if you don't get the test, trace, and isolate system working, then this second wave could be double the first wave. And that's really what we're seeing now. And, that seems to be the projection that's finally filtered through to decision makers.
Now, I've heard various people say, you'd need a crystal ball to know that it was going to be a second wave and so on. But actually, I think it was you and I talking right at the beginning. I think you made the point that it's not unusual for the second wave, if you get one, to be worse than the first. Why is that?
Well, this was right back in the sort of very, very early press conferences by the chief medical officer. Was really comparing this to the pandemic Spanish flu, about 1918. And what you saw then is you had a first wave and then you had a larger second wave. And that's really why the timings of these interventions were such to try and prevent that happening. But, as I say, the reason we're getting this second wave is because we're not isolating people with the virus. And that goes back to, why aren't you isolating them? Because you're not tracing them. And why aren't you tracing them? Because they haven't been tested. So it's all kind of, the whole strategy was based on test, trace, and isolate.
And what realistically, what happens now then? So we spend a month in lockdown. Do you see that month? I mean, it's slightly less than a month, isn't it? Just a couple of days less than that. Is that sufficient time to get to see the data as to whether that's working, or do you see an extension of that as likely?
Well, the problem with this is that every time you do an intervention, you don't see the results immediately. So it's going to take probably about a month to see the full implications of the interventions. You may see reduced number of cases, you may in a week, and then you may see reduced numbers of hospitalizations a couple of weeks. But you'll only see a reduction in the number of deaths in about a month. So really, we need to wait for that amount of time to see what the effects are. And of course, people talk about a lockdown, but this proposed intervention isn't a lockdown. It's less stringent than the first national lockdown. For example, things like schools aren't closing, and of course everybody wants their kids to go to school, but it does mean there is going to be more transmission as a result of not closing schools. So therefore, the intervention is going to last longer. So you could have a proper lockdown where everything closes, and that should get R down much faster. And it's this sort of trade-off between the economy and the virus. But essentially, that's not really a fair comment, because essentially, if you get the virus under control, then the economy can get back to normal. We can all get back to our daily lives, which we are desperate to do. So it's not economy versus health.
It's an interesting point you make there, because as we've heard, there's lots of controversy on both sides of the argument, if you like, saying, well, do we need this lockdown or not? And is the lockdown too heavy a penalty to pay, if you like, given what it's likely to do to the economy?
Well, so, I think the reason that it has been, is going to be implemented is that hospital capacity will run out very soon if we don't do anything. And therefore you have people, very difficult decisions to make. But, the thing about this is it goes up relatively fast in terms of the number of cases and takes a longer time to come back to where you were. So basically, the longer you leave it, the higher the number of cases go up, and the longer you have to wait to get back to where you were. So, and that's the time when the economy is suffering. So it's a very difficult thing, but listening to the Director of Public Health there, the sooner you do something, the sooner you can come back to normal.
Duncan, thank you ever so much for joining us again. I sort of hesitate to even ask it, really, but are there any positives that you can see?
It's sunny, right? It's sunny today, so there we are.
Well, thanks for uplifting end to that interview, Duncan. Look, we'll talk again next week if that's okay. But in the meantime, thanks for keeping an eye on the figures for us. Thank you. There you are, Dr. Duncan Robertson from Loughborough University, joining us here on BBC Radio Leicester.